Friends, the city of Oak Park joins the rest of the country and most of the world right now in the fight against the spread of the COVID-19 coronavirus. And as we enter the 7th week of Governor Whitmer's Stay Home, Stay Safe order, this current public health crisis is top of mind for all of us. My guest today is at the epicenter of that fight. I'm graciously joined by Kathleen Forzley, who is the director of Oakland County's Health and Human Services Division. So how, if at all, does this coronavirus pandemic intersect with Homeland Security?
Well, Homeland Security efforts are very important in terms of anticipating and responding to critical infrastructure needs during a wide scale and significant event such as the COVID pandemic. Pre-planning provides important measures that will reduce overall vulnerability due to the potential for such things as supply chain shortages that could negatively impact a response in our community.
Welcome to another edition of Virtual Meeting with a Manager. I'm City Manager Erik Tungate. On this show, I have the honor and privilege of welcoming in Kathleen Forzley, who is the Director of Health and Human Services for Oakland County. Kathy has close to 20 years of leadership service in Oakland County, first with Environmental Health Services, and since 2017 as Director of the Health and Human Services Division, which is the largest department in the Oakland County government. In her role, she oversees the county's health division, Homeland Security, and Children's Village. She's responsible for more than 40 public health programs, including a health improvement initiative known as Energizing Connections for Healthier Oakland, as well as the county's current efforts to stop the spread of COVID-19. Kathy, thank you again for joining me.
It's my pleasure.
So let's get right into it. I want to get right into it and have you start by telling us more about your role and about the focus of the divisions that you manage in the county government.
Right. Well, so as you said, we have 3 divisions. The health division is focused primarily in applying public health programs and tools to slow the transmission of COVID and flatten the curve. These goals are essential to reduce the strain on our healthcare system, especially our hospitals, who've been challenged to utilize their staff and resources to meet the demands of the life-saving functions that they do every day to save lives. If we were not successful in flattening the curve, we would overwhelm our hospital's capacity to take care of patients and save lives. So the health division works in a number of ways to flatten that curve, and they do that through surveillance and case tracing. They work to reduce the transmission of the community through things such as quarantines, and then prevention messages about social distancing and hand washing. We work on testing because we have to know where we're at to know where we're going and how to approach it. We're really focused on senior living facilities. We've just started some new initiatives in that regard. Our Homeland Security Division is the home of the Emergency Operations Center for the county. And this is a central point of communication for the entire county. First responders, hospitals, utility companies, and many, many others come together there every day, whether it's virtually or in person, and they talk about the challenges that each of them are seeing in the community and what do they need to do their jobs. And so the Emergency Operations Center is really key in securing assets that we need in the community. Such as you've heard about PPE being in such short demand. They work tirelessly to secure whatever assets they can find from around the country and bring them into the county. And then, of course, Children's Village is a detention and a secure treatment facility, as well as we provide shelter care for neglect and abused children. And so, of course, during COVID, our primary concern with them is to keep them safe and healthy.
You've just have a few things going on, in other words.
Just a few.
It's amazing. So I want to jump right into the discussion about the coronavirus. I wanted to first get your take. We keep hearing that coronaviruses aren't new, but, what does that really mean? And, what is it in terms of this COVID-19? What do those terms really mean?
So it is new. COVID-19 is new, but coronaviruses are not new. And that's a very large family of viruses that cause illness, many illnesses. Mostly you will hear about coronaviruses in conjunction with the common cold. So there are many strains, but it is also the family of viruses that's responsible for SARS is a coronavirus, which you may remember as a severe acute respiratory syndrome, and the Middle East respiratory syndrome called MERS. Those are much more severe diseases than the common cold, and so COVID-19 is similar to that in that it is much more severe than the common cold. And one thing they all have in common, coronaviruses are what's known as zoonotic viruses, which means that they can be transmitted from animals to people.
Wow. Okay. So, the severity of this coronavirus caught most of the world off guard. I imagine the county was as prepared as possible for a public health crisis, maybe more so than the federal government to some extent. But how, if at all, does this coronavirus pandemic intersect, with Homeland Security and some of the things you're doing there?
So in this county, we're very fortunate that the Health Division and Homeland Security divisions are under one roof, the umbrella of Health and Human Services, which means that these two units or divisions have been working alongside each other for many, many years. And the benefit of that to the people in Oakland County is that means they've been planning and preparing together. They have numerous preparedness plans that will address wide-scale disasters so that when a public health emergency comes along, they know how to work together, they know how to support one another, and we can really lean on the strength of their resources and their capabilities to make a significant difference in the county. So while this is a very different thing, we haven't seen a pandemic like that in the last 100 years, I have to say that we have been planning for large-scale disasters, which and public health emergencies that really put us in a better place than would have been otherwise. And I think we're much more fortunate than many other communities across America.
Now, I think, this has been talked a lot about in the national news. Do you think, we should get used to pandemics like this, now the advent of this one?
So we know that this can happen again, and we should plan that it will happen again, which means we need to stay fully prepared, and we need to rethink about a lot of things coming out of this. We need to remember some of the things we've learned about the transmission of disease while we've been talking about this for many years with flu. The wash your hands messages, the social distancing. I don't think it's really hit home until we watch our TV every day, seeing this spread across America. We've learned a lot about transmission. I believe that will stay with us for a good long time, and that we will probably make adjustments and changes to how we might do things in the future. But yes, we should plan that this could and likely will happen again.
And that kind of brings up, a second possible wave of this thing.
Right.
Where do you see that? Do you see us possibly as a strong possibility, let's say, of a second wave?
Yes. I think that pandemics always come in waves, but what we can control is this flattening of the curve. If we can bring case counts down and then still stay diligent, even after we've brought the case counts down, then we can push out a second wave, and we can even keep that second wave from being this gigantic peak of resurgence of cases. So whereas we anticipate it to come back again, because there'll still be cases that might be spreading in the background, we want to keep it from being a sharp curve upward again. We want to be able to address every single case. This is why testing is so very important to us, because we need to be able to do robust testing in the community to find these cases. And then we can do our contact tracing, which means we contact every individual that comes up positive. We find out who they've been around. We quarantine that case, get them the medical care they need. And we also quarantine those that they may have been exposed to. As long as we can keep doing that, we can keep that second wave from being so severe like it has been this time. And hopefully, too, we'll have more PPE, which means we can address it better, because we have the workforce properly behind the protections they need to do the work they need to do. So even though I anticipate we'll see, a resurgence possibly in the fall, it's hard to say when that could occur. It could be next month if we open things up and everyone goes back to business as usual. We could see an early resurgence of it, which is, I'm hoping that we can really impress upon people that we all play a part in this and we all can control what's in our future. And when I also said that, we can expect to see pandemics in the future, it doesn't necessarily mean it's going to be a pandemic with the severity of this one. Everyone is different.
Right, absolutely. I wanted to ask you maybe a two-part question here, but you had talked a little bit about testing. So I wanted to get into, we're here specifically in Oak Park, but you're looking at this county-wide. So if hopefully, as you mentioned, testing will become even more available than it is.
Right.
So how do you see, our residents here in Oak Park accessing testing sites, and what is the future of testing, maybe in the short term, in terms of will there be testing for every resident, or what's the status on that?
So right now, testing is limited to those with symptoms, or if you're an essential worker, whether you have symptoms or not, you can get tested. Now, you're right. This is all very dependent on the supply of testing that's coming in, which is still challenging. It's better than it was, which is why they've opened up testing a little more. We have some drive-through opportunities for the residents, and I'm happy to say as of today, we've opened one up in Southfield at the health department in Southfield on Greenfield Road. And that will operate this week from 9 to 5, and tomorrow the same. And then we'll be back again next week and weeks following on Mondays and Wednesdays. But it's by appointment only. And that's so we can get all your paperwork ready so that when you come, we can get you through the drive-through in really record fast time, like 2 minutes.
Residents can access that starting today, going forward now for the foreseeable future, from 9 a.m. to 5 p.m. And they can literally just drive up and receive a test. But
you have to get an appointment first.
You have to get an appointment first. Okay.
By calling our nurse on call. It's also a great number to call if you have questions about anything about COVID. And that number is 1-800-848-5533.
Now, more broad-based across the country, we've heard a lot about, testing is really the way we unlock this and the key to this, so we know who has it, who doesn't. I want to get into the antibody testing a little bit here. Mm-hmm. So what is your take on antibody testing? And there's a lot of talk about people who may have had it and then they can still get it. And what's the latest on that?
So antibody testing we have a lot of hope for, but it's not ready yet. And the reason for that is there's a lot of antibody tests on the market, but there's really only 4 that have gotten permissions through an emergency use agreement with the FDA to really market it. And so it's a very confusing world in the antibody market right now. And the problem is they haven't been out long enough to study them. And antibody tests really need to be studied because there's different curves. Nobody has really done enough testing with this to know what the curves mean yet. So getting a test back doesn't necessarily mean anything. We have a few that we have tried here, and we have people even have been diagnosed in confirmed cases of COVID-19, and it doesn't show up on the antibody test. But once again, we don't know what the curve looks like for that antibody test to know. So it's almost like you need both. You need an antibody test after we understand it better, and you need a COVID-19 test. So let's just say you had an antibody test that showed up positive. I don't really know if you're shedding virus or not by that test. I would need to know from the molecular test, the swab test, if you really do have it right now. So this thing is complicated, but we're making progress.
Yeah, that is great information, by the way. A moment ago, you had talked a little bit about, other viruses. And I wanted to just ask you, we obviously hear about a vaccine being possible. I think just today I saw a vaccine might be possible by January. How is that going to work? And maybe this is a 2-part question too. How is that going to work, do you think? And then part B would be, how is that going to work and then intersect with the normal flu season?
Okay, those are very good questions. So let's start with flu. The flu season, not knowing, you can't predict when that will start or not, but I think that it's very important that everyone be very focused that as soon as flu shots become available, vaccines become available in the late summer or fall, we should be focused on getting those. And the reason for that is one of the worst case scenarios, and we did have a number of those this past season, where people had the flu and they had COVID-19 simultaneously. And that just makes everything worse. So I anticipate a flu vaccine being available to us first. And so we should concentrate on getting those first. And then when a vaccine becomes available for COVID-19, and that's still to be determined when that will be, we should absolutely take advantage of that. The same thing happened during the H1N1 pandemic. The flu vaccine that fall came out first, and then people had to come back around closer to November, December, that became available, and people had to circle back and get another vaccine just for H1N1. So that will likely happen again. It's important to get both vaccines. A vaccine will be a game changer for us with COVID-19 because this is a highly contagious disease, which is why you're seeing across the country so many face covering orders, why it's so important to wear those. So until such time as we start to have immunity in the community from either people having cases or developing antibodies from maybe they didn't even know they had it, it was asymptomatic, but they've developed enough antibodies, or getting the vaccine, until that happens, we're going to have to keep these measures going to prevent the spread of it.
I think it's important to just unpack some of what you just said. The clarification, and this, I want to make this statement, and you tell me if this represents what you just said correctly. The flu vaccine, people should still plan to get the flu vaccine, and then if there is a vaccine for coronavirus, they should plan to get that as well.
Absolutely.
And I want to talk a little bit more about vaccines too. I've been wondering this, and now that I have you here, I get to finally ask you this. So the flu vaccine is not 100% effective at this stage. Was it 100% effective at one stage and the virus has mutated, or how does that work?
It really depends on our own immune system responses to it. And so some bodies are better at developing an immune response that's adequate to build enough antibodies. When they meet that virus in the community, they can fight it off and may have never even know they've come in contact with it. Others may get mild disease where the antibodies, start to go to work on that disease as soon as it encounters it, but then has to build more antibodies to fight it off. And then others just have very poor immune responses to vaccines, and they may only get limited benefit out of it, but we do strongly believe that we don't see anywhere near the severe disease with flu that we once did with people that have had the vaccine. We don't see the number of deaths occurring from it or severe hospitalizations. We believe it's milder. With older adults, though, their immune responses are not as good, which is why they have an adult version for flu vaccinations, which is a really big super dose of the vaccine, hoping to elicit a response from the immune system. But because we know that older adults generally don't have the same immune response as younger people do, we always market the fact that it's so important that everyone around an older adult or a baby who can't get vaccinated until 6 months of age should all be vaccinated, because even though I don't know I have asymptomatic flu, I can give it to that older adult, which we've clearly seen with coronavirus, and it may be very mild to me, but life-threatening to someone else.
So that's a perfect segue into my next question. I was going to ask you, I know people keep saying that they want to get back to normal, into their regular lives.
Right.
I think that, to me, just the sanitary aspects and the sanitary fallout, if you will, of this whole thing and how we approach each other, because as you just said, whether it's the flu or coronavirus or something else, everybody reacts differently to it. And a young person might have the flu or coronavirus and not even maybe know they have it, but just because they're not taking those steps, they might have passed it on to a grandparent or somebody else at the grocery store. Do you see this becoming a permanent part of our society where, you go to the grocery store and you're wearing a mask, forevermore?
If we look at some other countries over the past several years, we see more and more other populations that are really embracing that as a part of their cultures. I'm not sure I can see that happening in the United States, but what I'm hopeful for is that people have really recognized that one person may have very mild illness and an older person, or maybe even we've seen a lot of young people. Really surprising to us to see deaths amongst young people in this coronavirus. I'm hoping when they really recognize that, they'll remember it when they're in the community. We don't wear these face coverings to protect ourselves. They're to protect others. They're droplet. It's to contain droplets that we all are emitting when we talk, not just when we cough or sneeze, it's when we talk. And there's videos out there where you can see that when you're talking, what is coming out of your mouth that someone else may encounter.
Right.
And, this is a perfect solution to that problem. So I think it's very considerate of us to think about these things, that not in terms of ourselves, but all the people around us and our loved ones included.
Yeah, and that's, I keep thinking to myself that what are the positives that humanity takes from this, especially humanity here in our country. And to me, there's been people who have ignored guidelines and
right.
disrupted, but there's been way more people, the vast majority of people who have shown care for others and wearing, face masks and proper PPE and so forth. But to me, one of the positives is humanity in some ways has been restored. Our care for others, I mean, we've shown through in a very difficult time.
I agree. I see evidence of that every single day.
Yeah. So now let me switch over. I want to ask you maybe more personally, how are you holding up in all of this? 'Cause I'm working 70 hours a week running the city government, but I can't imagine what you're doing.
Yeah, it's been challenging. Just like my team here, we have a very large department, a very large health division, whereas many others are working at home, or unfortunately many not working. Our whole staff has been really engaged. We burn the midnight oil off 7 days a week. I see battle fatigue. So we're trying to help each other and learn to take care of ourselves. It's so important. If we don't take care of ourselves, we can't take care of anyone else.
I would just say, obviously I manage a local unit of government in Oakland County, and I kind of watch this from afar, but I would just say that watching the work that you and your staff and the rest of the county are putting into this, it really is, it's admirable, and it really puts the word service in public service, because you guys have really done some amazing things. And they're so appreciated, because I can tell you, Oak Park, we've been hard hit here in our city. And, every step of the way, you guys have provided guidance and assistance. And it's very, and that goes for our staff. I know our public safety officers have received proper PPE from you guys and the Homeland Security Division. And I so much appreciate it. Your family's holding up okay, because they're probably not seeing much of you, I would imagine.
I miss my grandchildren. I desperately want to hold my granddaughter.
Well, it's been one of the weirdest things. I can't imagine for you, but for me as well, because I have 2 young kids, and for me, everybody else is at home, and they keep saying, "Well, why are you not? Where are you going?"
Yeah, it's the same. Yeah.
So, but is there anything else that we didn't cover that you would like to?
There is one thing. I mentioned that we are really working on senior living facilities, and I'm sorry to say I did not have time right before I got on to check to see about the senior facilities that might be in Oak Park, but we really want to get into facilities and assist them with testing, not just the residents, but the employees too. It's really important for them. Once you get a case of COVID in a congregate care setting, we've seen it spread rapidly, even though they're doing everything in their power to stop that. And the answer to that is they don't know where the people are that may be asymptomatic. In the past, there hasn't been enough testing to do really comprehensive testing of a facility, but that's our goal. So we really want to spread the word, and we're actively calling facilities, trying to get them interested in this testing, because once they know who's asymptomatic in their facility, it can help them implement strategies to stop the spread. And so that is really our focus right now, is on top of trying to get more in the community tested, we really want to help these facilities keep their case counts down.
Absolutely. Well, I want to thank you so much again for being on the show. It's so much appreciated. Thank you again for joining us. I look forward to seeing you again next time.